Hello everyone, my name is Jacob Sarmiento, and my topic has to do with COVID-19 misinformation. More specifically, my misinformation topic is about the COVID-19 myths that are a product of news sources, including online news sources like social media. Being someone who felt confused at who to believe at the time of the pandemic, I always struggled with who I can trust in terms of COVID-19 information. After getting the virus itself, I would always question whether or not it was worth it to get the vaccine. I even considered not getting the vaccine at all, after hearing different negative perspectives on it, especially on the news or social media. Choosing the systemic racism lens to further evaluate the spread of COVID-19 misinformation, it's pretty evident that certain communities that are excluded may not have access at all to perceive what is true or what is false. With a lack of healthcare resources, those within excluded communities may not be able to distinguish between the factual information regarding COVID-19. On the other hand, those communities with access to healthcare systems are able to distinguish the difference between what is true and what is false. Now the question remains, how can we allow access for these excluded communities who do not have direct access to healthcare? I think specific facilities for these excluded communities should exist rather than completely denying them healthcare access. The socio-technical dynamics that led to the spread of COVID-19 misinformation directly has to do with the way social media functions. Most social media applications function in a way which allows any user to post whatever they want without needing any type of verification. This leads to posts with false information to be spread. The issue with COVID-19 misinformation is that many of the posts related appear to be factual, but they are just simply false information. There are many unfortunate effects of this COVID-19 misinformation toward the audience, as it can lead towards its audiences, as it can lead to health and disease concerns. For example, when the COVID-19 vaccine was initially released, there were already myths going around about how the vaccine can impact someone's DNA. If we look at the facts, it's evident that this is just a false belief that somehow was able to sway the public from taking the vaccine. Even considering myself, I was considering not taking the vaccine since I didn't know what sources or articles to believe in. With so much information about the vaccine and COVID-19 in general, it was difficult to separate the myths from the facts. Luckily, there have been a couple solutions that I've read upon. One of the main solutions that have been done in order to combat the COVID-19 misinformation craze is how specific agencies are working with big companies like Google to filter out the misinformation that exists. Specific companies like the World Health Organization have directly worked with Google to do exactly this. There are also other solutions, like making sure healthcare providers know how to deal with people who believe or are curious about misinformation. By making sure these healthcare providers and workers are prepared to deal with these people, it benefits the people who are confused with misinformation and helps differentiate the myths from the facts overall. The main concern now is how can we allow full information access for excluded communities so that they are not given and fed the wrong information.